Hi, it's Cupcake, and I have just another update for you guys. I just made a video on Saturday, but then something happened yesterday, Sunday, so I wanted to talk about it and yeah, just based on things that I've told people, advice that I've given, um, just feels really inaccurate now. And yeah, things that I've said, like what I believed before, I definitely feel differently. And so I just wanted to talk about what happened. So, yesterday morning, which was Sunday, I woke up. I woke up pretty early because my husband and I were going on a date to see Guardians of the Galaxy Volume 2. I woke up early with a pounding headache on the left side of my head, and my left eye was twitching, and it freaked me out. The pounding headache just kind of reminded me of like how I felt when I didn't take my blood pressure medication, and so it made me realize, oh hey, I haven't taken my blood pressure medication in like a week. And the reason for that is because I take vitamins in the morning and I take my calcium supplements at night, and so I would need to take my blood pressure med sometime somewhere in the middle of the day. I had decided, and then I just stopped taking my blood pressure medication. When I've been to the doctor, the last few times my blood pressure has been perfect, but that's when I've been on medication. And so, I have this headache, and it's reminiscent of not taking my blood pressure medication. And so I did that, and I took some Tylenol, and just kind of went on with my day. Took a shower, got ready, and for months now, I felt dizzy when I stand up from like a sitting position or laying down. When I stand up, I feel dizzy a lot of the time. So anyway, I was waiting for my husband to finish getting ready for so that we could go to the movies, and I was sitting on our stairs, and I got up to show him something on my phone, and so I was walking towards the bathroom, got dizzy, like the kind of dizzy where like it just kind of goes black for a second, and I reached my hands up to steady myself in the doorway of our bathroom, and I fainted. I came to with my husband like yelling my name to like get my attention, and I was like, what? And he said, you just passed out. And I was like, what? And I looked down. I had dropped my phone on the floor. We have our laundry basket outside our bathroom door. I like fell into that, and like it felt like when you're trying to fight off sleep. If you know that feeling, like when you're really tired and your body's shutting down, but you want to stay awake, and so you just keep, like kind of coming in and out. That's what it felt like, and I just, it almost felt like what I imagine a seizure to feel like. Sorry. It was really scary. Luckily, my husband caught me, and I didn't go down and hit my head or anything. But it was extremely scary. And we just concluded that it was probably from putting my hands up. I've noticed circulation issues. I've noticed them since surgery, but my husband made a point that maybe I was having the issues before and I just wasn't as active, and obviously I was eating more before surgery, and So I wasn't maybe noticing that I was having the problems that I'm noticing that I'm having now. I've been pretty active, and I've, like, the one time that like I said, that I checked my Fitness Pal, like I mentioned this on my previous video, I was like 500 some odd calories. So I don't think that I eat more than 800 calories on any given day. I probably stay around 600, and I've been pretty active. I've been working out. That's not enough to sustain somebody of my size that's working out. That much has become very obvious. So, and I'm sorry, I'm saying a lot, but yeah. Anyway, God, I'm saying Okay, so yeah, it was really scary, and my husband just, he kept an eye on me, just reminded me to hold on to the handrail. I had some fruit punch at the movie. I had eaten a little bit, but not a lot. I was like kind of trying to restrict myself because I feel like I've been overeating lately. And I stopped at that first feeling of fullness, which is what they had said, like what the dietitian had said that I should do. And so that's all going on. I've been like on my period, and my period's been really off. It's been really different since I had surgery, so I will like be on my cycle for a lot longer. And I've been like, there's been more bleeding and whatnot. Sorry if that's too much information. It's just what it is. So I have these different things going on, and I've been restricting myself, and I literally lost like 3 pounds this weekend, just all of a sudden. And it was just, I was not feeling well. I'm still not feeling well. I've had a headache all day, and I have not been feeling well. So, here comes the rant part of this video, and I'm sorry it's just kind of thrown together. I'm not quite feeling right now, and so I'm not feeling well. Anyway, so my first follow-up after surgery, I saw the PA. I was scheduled with the doctor, but I saw the PA. I guess that he had something come up. They called me that day to let me know that he wouldn't be there, that I could see the PA, and I was like, all right, whatever. So I go. And I told her at that point that I had been feeling dizzy. And so she's like, oh, well, let's check your electrolytes. And so we were going to do that, but she forgot. So the next month I come in, and she's like, okay, well, let's make sure and check your electrolytes this time. And I talked to her about how I was worried that I might be anemic at that point. And I talked to her about, I was worried that I was maybe not getting enough protein in. And she told me that protein-wise, as I'm fine as long as 70% of what I'm eating is protein. 70% of like 500 to 600 calories is not enough. I can see why other doctors' offices have their patients drink protein shakes, because we cannot physically eat enough at this point after surgery to sustain ourselves. I mean, the dietitian that I saw said, if you don't eat enough protein, then your body will start to take the protein from your heart. And so that was obviously of concern to me when I heard that. And so that's why I was like, I don't know if I'm eating enough protein. You know, I watch all these videos, I see all these people, like what they're doing, and what these doctors say, other doctors, what I've read online, other doctors have said, like straight from the doctors, articles the doctors have written, saying that you should be at a certain amount of calories, you should be at a certain amount of protein, especially like if you're going to be exercising and whatnot. And so it was of concern to me because I knew that I wasn't eating that much on like protein wise. 30 grams on a good day for me. That's where I'm at. That's where I've been at. And so, when I hear other people saying that they're being told a minimum of 50, you can see where where I would be concerned. So, I have brought these things up to my bariatric surgeon's office, and I had my electrolytes drawn. I didn't hear anything for 2 weeks, and I was just like, this is bullshit. I'm going to call and find out what my labs were. So I call, they call me back, and they're like, oh, it was fine. Like, your calcium was a little low. But at that point, I hadn't been taking calcium supplements. And so I was like, well, I've started taking them, so, okay. That was the end of that discussion. I mean, there was no further discussion about, like, why am I feeling dizzy then if my electrolytes are fine? That's what a good doctor's office would follow up on. But I'm just at the point where, like, oh, okay, well, they say that I'm fine, so, I just want to believe them. Of course, I want to trust, like, my surgeon's office. I want to trust that the plan that they have me on is healthy for me. Yeah. So, anyway, all of this had happened, and in the meantime, I'm having, like, cold extremities, like my hands and my feet, mostly my hands, are, like, feeling really cold and tingly. Like, they get tingly really easily. And, like, they'll fall asleep, if I'm sitting in a certain position for more than a couple minutes, they're falling asleep. It's just been really, like, uncomfortable. And then yesterday happened, with fainting, and it just made me realize, okay, there's something wrong. So I just took it easy yesterday, made sure to get my fluids in, made sure to eat more, I packed in more food, and just relaxed. And today I got up and went to work, and I didn't feel well all day, had a headache. So I called my internist's office. I have an appointment already scheduled with him for Friday. I've had it scheduled for months. He is my primary care doctor, but he does take months to get into. I mean, I could see, like, the nurse practitioner in his office, but I want to see my doctor. So I called his office, explained what happened, was worried about whether I should take my blood pressure meds again. My husband found the wrist blood pressure cuff that we've had for years, and in the closet, and I took my blood pressure this morning, and my blood pressure was normal before I took the blood pressure meds. And so I called to see if I should even be taking this, and is Tylenol okay? And so I called, talked to the nurse, and she said she talked to my doctor. She called me back a little while later. My doctor wants me to hold off on the blood pressure meds and said Tylenol's fine, and that he would, like, do some labs on Friday to figure out what's going on. And he's been my doctor for over 4 years, and I do trust him, and I feel like he cares about me, so I'm really hoping that he can help me. So there was that. And then the other piece is that I did have an appointment scheduled with my bariatric surgeon's office this month, but I am very angry that I brought up these things to the physician's assistant, and they were basically dismissed. Like, oh, well, that's normal, or like, that's to be expected, or like, don't worry about that. And I feel like they really just care about results and money, because my weight loss has been pretty good. Um, I'm like 14 weeks out from surgery, and this weekend I hit 179. I started at 234. That was my surgery weight. So even last month I lost, like, I don't know, at least 12 pounds just last month. So still losing a significant amount of weight, and going into my 4th month. So weight loss has been good, but it's not worth it if it's not being done in a healthy manner and it's making me sick. So I just wanted to let you guys know what was going on, because I have passed on advice that I have gotten from my bariatric surgeon's office, and I wouldn't adhere to that advice, because I don't feel like they have my best interest in mind. And that's really unfortunate. Um, in my second follow up, I was supposed to see the surgeon. I was told I was going to see the surgeon, and then in walked the physician's assistant. And I should have just said, no, I made the appointment with the doctor. I want to see the doctor, but I didn't. And that was a mistake. It was also very unfortunate that he didn't feel the need to see me. So I called my bariatric surgeon's office today, and I left a message explaining how very upset I am and all the things that have happened, and that I don't want to see their office again, and that I wanted to pass on this message because I think that they need to change the way that they're doing things, and I don't want other people to get hurt. So I left a message, received a message back from the doctor, just telling me that, like, they see some of these things in patients, and that the PA he feels is very good, and he's sorry that I didn't feel like things were handled appropriately, and that he would like to talk to me about my symptoms more. And of course they can see me for what's been going on, and it sounds like things have gotten to a level where they need to be addressed, and it was bullshit. So I won't be going back. I'm just going to follow up with my internist. I wish that I had a bariatric surgeon that I could trust, that I, felt like had my best interest in mind. But that's not the case. If I do choose to see, or feel like I need to see another surgeon, there are other surgeons. I won't go back to that office, but I will go to a different clinic. There are other surgeons. Unfortunately, this is where my insurance pays, but I will pay more to see somebody that I feel actually cares about me. So I guess my advice at this point is just do what feels right for you. I'm not saying don't listen to your surgeon. I'm hoping that your surgeon and his office cares about you more than mine did. But ultimately, do what feels right for you. If something doesn't feel right to you, then you should question it. Maybe you should get a second opinion. Don't just blindly follow because you think that a medical provider has your best interest in mind, because that is not always the case. And it can end up making you really sick. I mean, if I had followed the plan exactly, I mean, the PA gave me a hard time about eating like enlightened ice cream, saying that it could slow down weight loss. If I had not been eating ice cream, if I had not been eating chocolate, I would be at like 500 or 600 calories or less and exercising. Your body cannot survive. My body cannot survive on that. Like on less than 30 grams of protein, like less than 600 calories, and working out and being told, well, just make sure you keep pushing yourself harder. No. So don't blindly follow just because you feel like your provider has your best interest in mind. If you don't feel good about it, consult with someone else. You know, I don't regret having surgery. You know what I mean? I do not. I just want to make that clear. I don't regret having surgery. But I regret how things have gone for me. Obviously, I made a mistake in who I chose as my surgeon, and I made a mistake by by blindly following and thinking that that was the appropriate thing, especially when it didn't feel right to me. When everybody else is being told that they need to have 1 or 2, protein shakes a day to make sure they're okay, to be told that they need to have at least this many, calories and grams of protein a day, and my office, like my surgeon's office, is saying no, basically restrict yourself as much as possible, make sure you're exercising. Like, it's just really, really upsetting to me that this is how things have gone. And so at this point, I'm taking control back, and I'm going to be doing what feels right for me. And I'm going to be talking to my internist. I'm going to make sure that he runs labs, figures out what's going on with me, or I'll see another doctor, like, if necessary, until I figure out what exactly I'm missing that's making me sick, that's making me dizzy, that's making me, have like such a hard time, to find out where like the deficiencies are, and to go about this in a much healthier way. Because yeah, like, my weight loss has been great, but like I said, it's not worth it. I mean, it's not worth it if I die, So just please, like, follow what feels right for your body. Question things that don't feel right. And take care of yourself. Because what's the point in losing weight if you're not around? Yeah. Anyway, so that's what's going on with me. I hope you guys are all doing well. I will let you know how my doctor's appointment goes this weekend. And thanks for watching.